Basta graft and corruption yun. It's a very serious offense and they're parang, they're not agree. They should be dismissed. Maraming Pilipino sa labas naghahanap ng trabaho. Hindi ko kailangan itong mga... I do not need you in government.
The Newsday continues. The Newsday continues here on One News Now. I'm Charles Lejano. Drugs and Daluyong to give us more details on this. Greg, just how many reports of fake vaccines has the FDA received thus far? And could you give us more details on which particular vaccines they're talking about?
Charles, unfortunately, we have yet to receive a more detailed report from the Food and Drug Administration as to the number of reports they are receiving pertaining to fake COVID-19 vaccines. But according to FDA Director General Eric Domingo, these are reports coming from citizens and international authorities. This include the fake vaccines detected by the World Health Organization in Mexico back in February this year. Charles?
Yeah, Greg, is this isolated? I mean, is this unique to the Philippines, or has the WHO been monitoring these types of cases of fake vaccines outside the country?
Yes, Charles, this is something that the WHO is monitoring monitoring across the globe. As in fact, on March 26th, the World Health Organization issued a medical product alert, alerting its member countries, including the Philippines, against a fake COVID-19 vaccine, as I've said, detected in Mexico back in February, involving counterfeit products of Pfizer and BioNTech COVID-19 vaccines. As to our situation here in the Philippines, the Food and Drug Administration says we have not yet seized any as of the moment. Charles?
Right, just so the public knows, what vaccine brands in particular have been counterfeited so far, and if the government hasn't seized any of these, what are they doing to prevent this?
Charles, aside from the detected counterfeit products or counterfeit COVID-19 vaccine of Pfizer and BioNTech in Mexico, we have not yet received any other reports pertaining to possibility of counterfeit products of other brands of COVID-19 vaccines. And if you may repeat your other question, Charles?
Right. Since the government has not seized any vaccines from peddlers, as you mentioned, what steps has the government taken to try to resolve this?
Yes, according to FDA Deputy Director General Oscar Gutierrez, they are beefing up their inspectors, the number of their inspectors in the National Capital Region. According to the FDA, they currently have around 50 inspectors in the National Capital Region, but they are planning to have additional enforcers in preparation to the further supply of COVID-19 vaccines, as well as the possibility of other reports against counterfeit products of other medical devices and products. Charles?
Right, Greg, as we have vaccines coming in already into the country, how can the general public distinguish the fake ones from the legitimate vaccines? I mean, apart, of course, from securing it from the proper sources, is there a way to distinguish the fake from the original?
Charles, the FDA admitted that sometimes it is difficult to spot the fake ones from the genuine vaccines, unless we will be doing laboratory tests. But sometimes they compare the packaging of the original ones to the fake ones, and also the clarity of the solution or the content in the vials of these vaccines. Charles?
Right, Greg, what penalties are in store for these for those who will sell or make these fake vaccines?
Charles, according to FDA Deputy Director General Oscar Gutierrez, under the Food and Drug Administration Act of 2009, violators who may be proven to be manufacturing, manufacturing and distributing of counterfeit products may face a year to 10-year imprisonment or 50,000 to as high as 5 million peso fine. Charles?
Thanks for that, Greg. That was Greg Gregorio joining us live from Mandaluyong. The P3 variant, or the COVID-19 mutation originally found in the Philippines, may be resistant to vaccines. That's according to a report released by Forbes. This P3 variant is supposedly a third-generation COVID mutation from the P1 Brazilian strain, which is highly resistant to neutralizing antibodies from vaccines or other infections. The article emphasized that public health measures must fill the gaps, while manufacturers are still developing vaccines that can cater to new variants. Transport authorities continue to enforce guidelines under the enhanced community quarantine placed within the NCR Plus bubble. To give us the latest on their operations, we have Patricia Mangune. She's reporting live from the Ortigas bus stop in Mandaluyong. Pat, good afternoon. What do you have for us?
Charles, the Highway Patrol Group conducted a random inspection in some of the public transport terminals in Metro Manila. That's while the capital region remains under the ETQ bubble this Holy Week. The random inspection covered the Parañaque Integrated Terminal Exchange, or PTEX, as well as the loading and unloading bay at the SM North EDSA. The HPG was led by its director, Alexander Tago. The group seeks to ensure strict compliance of the IATF and DOTR requirements under the enhanced community quarantine. The HPG checked if bus operators were observing the limit of 50% passenger capacity, the one-seat apart policy for passengers, and the installment of proper plastic barriers and other health measures. They also made sure passengers were composed of APORs only, or authorized persons outside residents, for basically medical frontliners, employees, and persons with essential or emergency travel. All they have to do is present their company IDs or certificate of employment and other documentary proof of their travel. HPG can also give humanitarian consideration for some who urgently need to go home to their families. Tagum also checked on the readiness of their officers deployed in these transport terminals, and evidently, there were fewer passengers at these terminals waiting to board public transport vehicles. Charles, the HPG personnel are also deputized to issue LTO traffic violation tickets to drivers who refuse or who fail to obey or comply with the ECC rules. Passengers were also warned that they are prohibited if their travel is for leisure and non-essential. Right?
Home except for essential travel. But do we know whether the HPG has apprehended violators today? And if so, how many violators have been recorded so far?
During the inspection, Charles, this morning, no violators have so far been spotted, but we'll wait for the consolidated data from HPG until later this afternoon. Charles?
Right, and what penalties await said violators if in fact they are apprehended by the HPG?
If, for example, the bus drivers or any other public transport drivers will exceed the 50% maximum capacity, they can be issued a ticket and their driver's license can be confiscated. That will mean they're overloading or taking in excessive passengers. While for the passengers, they could be denied their travel if they violate any protocol without a face mask or face shield, or if they are unauthorized to travel. Paul?
Thanks for that, Pat. Once again, that was Patricia Mangune reporting live from Mandaluyong. Vaccine confidence among Filipinos remains low despite the availability of shots and the rising transmission rate of the virus. Why are Filipinos still hesitant to take the vaccine? Let's get the answers from this report by mobile journalist Stanley Gahete.
Josefa is a medical frontliner in a Quezon City hospital who knows the importance of vaccination. Yet even she admits she hesitated at the last minute.
Konting kaba, ang naramdaman ko was mainit. So it's hot flash talaga. Nag-shoot din yung aking BP from 160 to 100. But 15 minutes lang yon. and then went back to normal na.
In efforts to speed up vaccination, government faces several challenges amid the surge of COVID-19. Some people would like to postpone their vaccination even if the vaccines are already available. Others refuse to be inoculated, doubtful on the efficacy of the vaccines. The recent Pulse Asia survey showed an increase in the number of Filipinos who said they would refuse a COVID vaccine. From 47% in January, the number rose to 61% in the first week of March. The three main reasons for the hesitation: concerns over vaccine safety, followed by questions over efficacy.
Because of the Dengvaxia issue, naturok na yan sa mga kaisipan ng mga tao na ang adverse effect nakakamatay.
The lack of confidence in it within a wider picture, hindi na for COVID-19. Even for the regular immunization we've had for kids, mababa.
Experts say a big part of the problem is the infodemic that came with the pandemic. While health workers were busy waging war, government dropped the ball in the communication strategy. The problem was overwhelmed by so much information, some of it wrong, others misleading.
Nobody is controlling the infodemic. Nobody is really addressing the dangers posed by the infodemic. Messages, which may or may not be science-based. So it adds to the confusion.
Add to that is the mixed or confusing signals from government officials on the vaccine drive, from who should get vaccinated first to which vaccines are safe for which sector. Even the president himself may have undermined his health officials when he announced that he prefers to wait for his favored vaccine brand.
Let's just say wala akong tiwala.
Pakita ko ba ng information drive ng government natin to increase vaccine confidence? Maski sa TV or any platform. Mahina ang communication natin.
It would be hard to attain herd immunity if people are still afraid to be vaccinated, despite the government's appeal to the public to rebuild their trust in vaccines against the coronavirus. And now that the Philippine government has imposed a similar lockdown to the National Capital Region and nearby provinces, we see public confidence on vaccines improving. Stanley Gate, we are One News.
LDR. Join Riza Diaz later at 2 p.m. as we continue to monitor the day's biggest stories. Mask on, wash hands, stay safe, Philippines. Stay negative, but be positive. Kaya natin to. I'm Charles Lejano. We are One News.